My name is David Sigman. I see some familiar faces out there tonight, and I see some unfamiliar faces, and I welcome everybody here. So why are we here tonight? Well, I'm certainly here because I want to educate you all a little bit about a very common problem that we see in a lot of our patients, and that's erectile dysfunction. Now, we take care of a lot of conditions as urologists. We take care of, some of the more difficult things such as prostate cancer and bladder cancer. But to me, there's a lot of other types of issues that we face as urologists that are equally important. Some conditions are life-threatening, but others have a big impact on lifestyle. And certainly erectile dysfunction is something that impacts a lot of men. It also impacts couples, so it's not just one person's problem. It can affect relationships, and that's why we're here to give you a little bit more education tonight. So I'm going to talk a little bit first just about erectile dysfunction and some of the treatment options, and then Dr. Leone is going to talk about some of the other treatment options. So we'll go ahead and get started here. Tonight we're going to talk about understanding erectile dysfunction and what we can do to help you. First of all, what is erectile dysfunction, who has it, and what causes it? Well, erectile dysfunction is the persistent inability to achieve or maintain an erection firm enough to have sexual intercourse. Certainly, people can be sexually intimate without an erection, but in order to have intercourse, an erection is obviously necessary, and most couples feel that that's a very important part of intimacy, so that's why it's so important. Most people don't realize how prevalent it is. I have men come to my office in their 20s and 30s, and men come in their 90s, and everybody's a bit surprised to see how erectile dysfunction impacts them. If you look, 1 in 5 men greater than 20 years old have experienced erectile dysfunction at some point in their life, but this is something that's, I think very eye-opening. Almost half of men over 40 have some degree of erectile dysfunction, so it impacts about 39 million American men. How does an erection happen? I mean, that's something that a lot of people don't understand, so just to kind of give you a little background here, when a man's aroused, there's nerves that surround the penis, and the nerves become active. These muscles around the arteries of the penis relax, so more blood flow comes within the penis, and then the penis engorges and becomes erect. What keeps the erection there is the fact that all of this blood in the penis compresses the veins, so the blood can't leave the penis very easily, and that enables the penis to remain erect. So what causes erectile dysfunction? Well, the most common cause is vascular disease, and as I tell my patients, the blood vessels to the heart and to the brain, the blood vessels that are impacted when a man or a woman has a heart attack or a stroke, those are big blood vessels. The blood vessels that go down to the penis are quite small blood vessels, so they may be impacted much earlier before somebody would have any heart issues or other types of vascular issues. Certainly diabetes is a big factor, and there is a big crossover between vascular disease and diabetes. Certain medications can impact erections, and then there's a bunch of other less common causes such as pelvic surgery and trauma, some neurologic causes, and some endocrine causes. Erectile dysfunction can be the result of an early warning sign of various treatments for prostate cancer, diabetes, and certainly heart disease. The reason I'm here is because I know erectile dysfunction is a huge quality of life issue for a lot of men, and it can have a broad impact. Just the general health perception of folks who are suffering with erectile dysfunction can be quite poor. It can cause people to become somewhat isolated, and really it can impact social functioning, mental health, physical functioning, vitality. All of these things are major impacts that can be affected by erectile dysfunction, and that's why it's so gratifying to treat this, because when you have somebody who comes in and they're feeling down because of these issues, and we can do something to impact that, it's very gratifying. What are some of the options to help as far as erections go? Before we get to that, who treats erectile dysfunction? Some of you may have been to your primary care physician. Some are very comfortable prescribing medicines, giving you a general understanding of erectile dysfunction. But as urologists, we're specialized to focus on diseases of the male and female genitourinary tract. And even more specialized is a prosthetic urologist like myself and Dr. Leone, and we specialize in various surgical treatment options using prosthetic devices to help with erections, specifically the penile implant that Dr. Leone will talk about a little bit later in our discussion tonight. Here's the various treatment options, and we're going to go through each one a little bit. The oral medications, injection therapy, penile implants, vacuum devices, and urethral suppositories. So first, oral medications. Before Viagra came out, there really wasn't a whole lot going on as far as erectile dysfunction. There were some natural type substances that had very minimal impact, but then Viagra came out and a bunch of other products. So oral medicines took off. And how do they work? Well, what they do is they increase blood flow to the penis, and that helps improve, erections in that manner. It requires sexual stimulation. The medicines are to be taken an hour before anticipated sexual activity. Most medicines work for up to 4 hours, and with Viagra it can be 4 to 8 hours. Cialis can work up to 36 hours. The medicines are not to be taken more than once a day. Certainly with Viagra, Viagra can be affected by food and alcohol. I always tell my patients who take Viagra, try not to eat a heavy meal, and certainly not a fatty meal or alcohol before taking it. It just doesn't work as well. So how effective are medicines? Well, about 50 to 85% of people will respond to the medications. Half of men who have erectile dysfunction after prostate surgery, though, stop taking the pills. And it's very important to note that men with diabetes are 1.5 to 2 times more likely to move on to other treatments because the medicines may not be effective. Some of the problems with the medicines, there are some side effects. Some people complain of a headache, certainly facial flushing, a stuffy nose, or an upset stomach. It's very important for people with heart disease to talk to their cardiologist to make sure that they might be a candidate for some of these medications, because sexual activity certainly can be a bit of a stressor if somebody has significant cardiac disease. And most important, these medicines can't be taken with nitroglycerin or nitrate products for people who have significant heart disease, and that's really when we get the cardiologists involved. So the next option would be something called a vacuum erection device. And this is a hollow tube that's placed over the penis. And there's a pump which can either be hand activated or battery activated. And with that pump, that creates a vacuum that pulls blood into the penis. If you just took the device off, the penis would go back to its flaccid state. So what is needed is this constricting band that's placed at the base of the penis in order to maintain the rigidity of the penis by trapping the blood there. This is effective in about 68 to 80% of patients. However, with this initial success rate, there's been studies that have shown that up to 86% of patients decide to move on to other means of achieving an erection. So why is that? Well, part of the problem with this device is blocked ejaculation. So when a man ejaculates, there's this constricting band at the base of the penis, so some men complain of pain with ejaculation or just lack of satisfaction with this device. There can be some bruising of the penis, some discomfort within the penis. This constricting band is left in the base of the penis too long. There can actually be coldness of the penis or numbness of the penis. That's some of the issues with the vacuum device. There's this urethral suppository called Muse that came out quite a while ago, and this was really thought to be something very novel because the device is placed within the penis. You insert this little suppository which dissolves directly into the erectile bodies of the penis. And we thought that this would be a fantastic option. Unfortunately, it causes a lot of urethral burning, a little uncomfortable when you're trying to do something pleasurable and you're having pain. That's really not a good combination. In addition, the success rates are a little bit more poor than some of the other options, only 40 to 65% success rates. Most men discontinue therapy after 6 to 8 months with this product. The last option I'm going to talk about is intracavernous injection therapy. And how does that work? Again, the same premise of that suppository, but you actually take a very small needle, inject it into the sides of the penis, into the erectile bodies of the penis to deliver the medication directly where it needs to go. The onset of the erection is usually within 5 to 20 minutes. This can be 60% effective and 60% patient satisfaction rate. Despite this, as you can see in a study of 254 men, only 20% of men continue this. Usually the look I get in the office from a lot of men is a little cringe when they say, "You're going to put that needle where?" And that's understandable. It's not terribly painful. Certainly people with diabetes who have to give themselves insulin understand what it is to inject themselves, and it's a very small needle. As far as side effects, it can be a little bit painful with the injection. Long term, because of the injection therapy, there can be some scar tissue which can occasionally lead to some curvature of the penis or fibrosis or scar tissue within the penis. The biggest concern with injection therapy is something called priapism, or a prolonged erection. So we tell all of our patients who use this product that if they have an erection that lasts longer than 4 hours, they need to go right to the emergency room where we can give them a medication to bring the erection down. The most common reasons for discontinuation of injection therapy include lack of efficacy with unsatisfactory erections, pain, or people who just don't like to use injections. So at this point, I'm going to turn the program over to Dr. Leone.
It's a pleasure to be here. I appreciate the opportunity. Dr. Sigman talked about the different medical treatments for erectile dysfunction, and I like to emphasize those with my patients before I get into the surgical option, because it's good to remember about the penile implant. While it's considered extremely successful and effective, once you've gone here, you've sort of crossed the Rubicon, as I say. I mean, you really can't go back, okay, to some of these other forms of therapy. And I think you'll understand why as I explain it. The implant sort of takes the place of your normal physiologic tissues. So then to try and treat it with medication or with injections after an implant's been put in won't be successful. So it's a great way to treat it, but it's important to understand the commitment that you're taking on when you do have this placed. So there are different kinds of implants that can be placed. I think a simple way to think about them is dividing between the malleable implant and the inflatable implant. So the malleable implant is simply a bendable pair of rods, and they're jointed much like a child's snake toy. They have some firmness to them, and they're placed into those two erectile bodies of the penis. They're going to be firm all of the time, and the penis can simply be bent into a downward position or an upward position depending upon what you're doing at the time, right? So that's an older way to treat erectile dysfunction surgically. It's certainly not the common way it's done now, because there's been advances, and the latest implant we're placing is an inflatable implant. And what's nice about the inflatable implant is it mimics the typical states of the penis, flaccid versus erect. And the way it works is that a pair of cylinders are placed into the penis, and those cylinders can inflate with a fluid, so that when it's time for sexual activity, there is a mechanism, which I'll explain in a minute, to pump fluid into the cylinders, which allows them to become firm and straight, and it points the penis in an erect fashion and mimics an erection quite effectively. And then when it's not time for sexual activity, that fluid is drained out of the cylinders into a reservoir, and it allows the cylinders to collapse and the penis goes flaccid, right? So it's very similar to the natural state of affairs. The pump to accomplish the transfer of fluid back and forth between the reservoir and the penile cylinders is located in the scrotum. When the pump is squeezed, it pushes the fluid into the cylinders, and there's a release button to deflate it back into the reservoir to alternate between the two states. It's considered an extremely effective form of therapy for erectile dysfunction. It's very durable. Approximately 94% are still working 7 years after they've first been implanted. So patients want to know how long is it going to last, and the hope is that it's going to last the rest of your life. Now, because it's a man-made device, and things can go wrong with man-made devices, they can malfunction, it could spring a leak. There are occasions when it does stop working and it can be replaced. So that's certainly something that could be done if necessary. But thankfully, that's usually not necessary in the majority of our patients. The benefits, obviously, it's a permanent solution to erectile dysfunction. It's there when you need it. It's non-medication. There are no side effects the way you might think of side effects with pills or with injections. It allows you to be spontaneous and to use it at any time. You can keep it up for as long as you like. There's sort of no time limits with it. With the vacuum pump, for example, the cylinder that Dr. Sigman talked about with the constriction band, after a certain amount of time you want to release the band because you're sort of strangulating the tissues. You can't leave that on for hours and hours. But with this, there's no time limit. Completely contained within the body. Because it's in a deflated state, looks so natural, people really don't know you even have it. Oftentimes you would tell them if you wanted them to know. Otherwise, they might not even suspect it. It doesn't interfere with ejaculation or orgasm. So that's a central nervous system process, ejaculation brought about by sexual stimulation, and that's all sort of hardwired in the brain. As Dr. Sigman had said, you can have ejaculation without an erection. It facilitates ejaculation because of the stimulation of intercourse, right? And the pump, the cylinders, the device doesn't interfere in any way with your ability to ejaculate. It doesn't adversely affect that. People say, well, do you feel the device? Once you've healed from it, you really don't. It's sort of just in you and a part of you. They ask if you feel the erection. The erection is probably more of a mechanical lack of sensation, but the nerves of the penis and your genitals are all completely intact and unaffected, and all the pleasure of tactile touching, stimulation, etc. is all perfectly intact and normal. Many patients have had this done. Nearly 500,000 patients have been implanted with the implants, the inflatable implants. They've been used for many years. When it comes to insurance coverage, it's typically covered. Medicare, most private insurance companies cover it. There are deductibles and copays, etc., that are worked out with the billing department. When it comes to the risks, it's important, right, to discuss that specifically with your doctor, the risks of the procedure. I could tell you just sort of generically the risks of an implant. We are always on guard against infection. We mentioned malfunction, right, a low, maybe 6% after 7 years of malfunction. And the infection we guard against, it's a sterile surgery. We have you prep with an antibiotic scrub for several days. Every morning before, leading up to the time of the surgery, you're given an antibiotic. At the time of the surgery, typically you go home with several doses of an antibiotic as well to help guard against infection. We take that very seriously. I think you could expect some degree of discomfort, right? It's a surgical procedure. I can talk to you a little bit about the procedure. It's put in through a very small incision, typically about 1 inch long. The incision can be done either through the scrotum beneath the penis, or it can be done above the penis. My style is to place it above the penis in a horizontal fashion, maybe 1 centimeter or 2 above the penis, about 1 inch long. And through that incision, we can place the entire device, right? And by that I mean the cylinders that go into the penis itself, the pump that's placed down into the scrotum, and the reservoir, or the bag that holds the fluid when not being sexually active, gets tucked into the pelvis, typically behind the pubic bone, and all can be reached and placed through this single small little incision. The incision is closed with 2 layers of dissolvable sutures, so the sutures are going to dissolve, they don't need to be removed. Oftentimes a surgeon will place a surgical drain. Typically that's left in overnight, perhaps 1 to 2 days, and that helps evacuate any blood from within the incision out of the body, so you don't have as much swelling or what we call a hematoma collection under the skin surface. It's not always necessary. The drain usually comes out here in the office the next day. I tell people to expect a little discomfort, okay? You know, it's typical to have some pain and some swelling and some bruising of the genitals and the lower pelvic area where the procedure is done. And it's really, I think, just your body's reaction to the dissection to place the implant in. The swelling and the bruising and the discomfort can last several weeks. Typically, if you give it 3 to 4 weeks, things have really started to settle down. We ask you not to engage in any, certainly no sexual activity for the first 2 to 4 weeks while everything heals. And then any strenuous activities or heavy lifting, ask you to take it slow during the recovery phase. But the procedure is done as an outpatient. We will typically do them right here in our ASC, here in this office. For patients who are not ideal ambulatory center surgical candidates, maybe for past cardiac reasons or other medical conditions, we'll sometimes recommend that we do it in the hospital setting, but still typically done as an outpatient, so you get to go home later that day. So in summary, erectile dysfunction, it's a common problem. It affects millions of men. Myself, Dr. Sigman, our partners, we see this every single day. There are a variety of treatment options, both medical and surgical. Penile implants can offer a permanent solution. Once it's in, we hope that it works for the rest of your days. It's something that I would recommend you talk about with your partner to see if it's right for you. I do encourage you to try the medical options before surgery, or at least consider them, certainly, before proceeding with surgery.
Okay, well, I wanted to thank you all for coming. I wanted to thank our Facebook Live people for giving us your attention and listening. And thank you, and we'll be around afterwards to answer any other questions you might have. Thanks for coming out.